Hi, my name is Emily, and this is Olivia, Temple, and Hannah, and we are going to talk to you today about oral health during pregnancy and the oral health of your children after you give birth. So, for oral hygiene and its effects on pregnancy, bacteria from a mother's mouth can actually be transmitted through the blood and the amniotic fluid in the womb to her unborn child. This could contribute to the risk of a premature delivery, a low birth weight baby, premature onset of contractions, or infection of the newborn child.
So the importance of good oral hygiene during pregnancy. Plaque can build up and occurs more rapidly during pregnancy, and which can contribute to pregnancy gingivitis, and if it's untreated, it can progress into periodontal disease. And the harmful bacteria can be passed on to the baby if proper care is not taken during pregnancy.
So what is pregnancy gingivitis? Pregnancy gingivitis is swollen gums which may be sore and more susceptible to bleeding and are common during pregnancy. Pregnancy gingivitis is caused by the hormonal changes that increase the blood flow to the gum tissue and cause your gums to be more sensitive, irritable, and swollen.
So, how to brush. You want to use toothpaste with fluoride and brush at least 2 times a day. If your gums are swollen during pregnancy due to pregnancy gingivitis, switch to an extra soft, bristled toothbrush and brush as gently as possible. And so, how you want to brush is you want to make sure you're brushing all your teeth. You're going to start in the back and make gentle circles, making sure you're going towards the gum line and go all the way around. You want to do the same thing on the lowers as well as the inside. And you want to make sure you brush your tongue as well.
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn
How to floss. Flossing at least 1 time a day during pregnancy is very important. It's important not to snap the floss in between your teeth because it could damage the gums. And make sure you make a C-shape around the tooth to get under the gum line. And flossing is important because healthy gums do not bleed. If your gums are bleeding, it's a sign of gingivitis.
Alright, so you want to make sure you're hugging the tooth. Go straight down in between, go underneath the gums, and go back and forth in a seesaw motion. Make sure you're getting everything. Come back up and do the same thing on the other side. And do that between all your teeth.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around a middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about 1 inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions.
Mouth rinses are really important. You want to make sure you use a fluoridated, alcohol-free mouth rinse daily. This helps strengthen the enamel to prevent tooth decay. And then some brands that have fluoride that are really good for pregnancy and during pregnancy is Act, Colgate, Listerine, and Crest.
And most of these mouth rinses can be found at any grocery store or CVS or Walgreens.
So morning sickness and its effect on oral hygiene. Morning sickness is a very common thing in people who are pregnant. Vomiting can cause stomach acid to come up to your mouth and could cause erosion to enamel surfaces. And then after vomiting, mix a teaspoon of baking soda with water and rinse your mouth out with that. And do not brush directly after throwing up because this could cause more damage because stomach acid weakens the enamel. And if you brush directly after, it could cause the enamel to erode. And in baking soda, we use that with water because it's basic, which will even out the acidic, and will help neutralize out the stomach acid.
So dental visits during pregnancy are very important and should be performed every 6 months. Pregnancy gingivitis that was stated earlier is a major concern of pregnancy, and if not treated could turn into periodontitis, which is permanent bone loss to the bone that supports the teeth. Routine appointments should be done during pregnancy and are very important to monitor areas in the mouth for pregnancy gingivitis, dental caries, and other issues that may come up.
So for the oral hygiene of children, it is very important that they have their first dental appointment after the first tooth appears and no later than 12 months of age. After their initial appointment, children should visit the dentist every 6 months or more frequently to build their comfort. And these visits are very important to build a rapport for the child while allowing the dentist the ability to follow the growth of the patient. You don't want to delay it too long because then your child can become scared of the dentist, and you always want to make sure you're telling them good things about going.
Did you know that children should have their first dental visit after their first tooth appears or before their first birthday? This visit is important because as soon as your child's baby teeth appear, they can develop cavities. In most cases, the first visit is mainly for the dentist to examine your child's mouth and to check for growth and development. During the visit, you can expect the dentist to check for mouth injuries, cavities, or other problems. If your child is going through a tough time with teething or in the habit of thumb sucking or excessive pacifier use, ask your dentist for advice on how to handle these issues. When scheduling the appointment, try to choose a time when she will be more cooperative. Morning appointments tend to be a good time. Try to avoid scheduling an appointment during her usual nap time, since this could lead to a cranky visit. Some dental offices will give you the opportunity to fill out paperwork ahead of time. If you have dental insurance, be sure she's included on the plan before the appointment. On the day of the visit, make sure your child has had a light meal beforehand. Some children may gag, so you want to avoid a heavy meal before the appointment. Try not to give snacks in the waiting room because those will be all over her teeth during the visit, which will make the examination difficult. Here are a few tips to help make the experience positive. Try not to let her know if you're concerned or anxious about the visit. Children can pick up on your emotions, so emphasize the positive. Don't use a dental visit as a punishment or as a way to bribe your child. Talk with your child about visiting the dentist. Let her know that she's going to meet new people and ride up and down in a dental chair. Have her practice opening her mouth so that the dentist can count and check her teeth. Make it fun and let her look and count your teeth as well. There are many children's books and videos that can help you prepare for the visit. Reading stories or watching videos about a first dental visit may help your child be less fearful and more confident. If she's upset during the visit, work with your dentist to calm her. It's important that you trust the dentist and let them lead the conversation. Give the dentist a chance to turn the visit around. Don't wait for your child to start school or until there's a dental emergency for her to go to the dentist. Being proactive about the future of your child's dental health today will help her for the rest of her life.
Okay, so how to brush for your children. So you're going to use a small amount of toothpaste. You want to make sure you're using kids' toothpaste. Don't use anything with a lot of fluoride. Usually like a pea-size amount. And then you're going to start brushing between ages 2 to 5 just to make sure that we're getting all that plaque off that can cause early childhood caries, which we'll talk about later. For children, we like to do big circles. So make sure they're getting all the way in the back, or you doing big circles all the way around all the teeth. And also make sure they're getting the insides and do the same thing on all the teeth to make sure that they're getting the plaque off the best they can. And make sure you can also observe just to make sure they're doing that properly.
Yeah, and probably while they're still young, it's probably best to go ahead and brush their teeth yourself because they're not going to be able to reach all the areas that they're supposed to, and make sure that they're getting it clean. So definitely recommend helping them out.
And then how to floss for children. Flossing should start when your child has 2 teeth that touch. This is often around ages 2 to 3. And then always floss under the direction of your child's dentist or primary care provider. Children often need help with flossing until they are between the ages of 8 to 10. And then so how to, you cut off a piece of floss about 18 to 20 inches long. Lightly wrap each side of the piece of floss several times around each middle finger. And then carefully move the floss in between the teeth in your index fingers and thumbs in an up and down, not side to side motion so that we don't pop the gums. And then bring the floss up and down, making sure to go below the gum line, bend it to form a C on each side of the tooth.
So it's very similar to regular flossing for an adult, but you just want to make sure you're supervising your child so they're not injuring their gums at all.
And get them involved early on when you're doing their oral care routines. That way it can become a habit for them, so when they get older, they're already used to flossing and it won't be an issue later.
And if they're not really responding to regular floss, you could always try a floss pick, just something that's fun. A lot of them come in shapes and different characters and stuff, and they really like that.
Getting kids to brush their teeth for 2 minutes, 2 times a day can be a challenge. But teaching them to take care of their teeth can help instill a lifetime of healthy habits. It may help to encourage your child that toothbrushing is fun and helps fight the bad guys, like sticky plaque. There are a lot of videos, games, and apps online to make brushing more fun. Try letting your child pick out his own toothbrush and toothpaste. After all, there are a lot of child-sized toothbrushes with soft bristles in favorite colors and cartoon characters. And fluoride toothpaste come in a variety of flavors, colors, and some even have sparkles. Just look for toothbrushes and toothpaste with the ADA seal of acceptance to be sure that they do what they say. Start to brush your child's teeth as soon as they appear. For children younger than 3, use a child-sized toothbrush and just a small amount of fluoride toothpaste, about the size of a grain of rice. When your child is between the ages of 3 and 6, use a pea-size amount of toothpaste. To begin brushing, place the toothbrush at a 45-degree angle to his gums and gently move the brush back and forth in short, tooth-wide strokes. Brush the outer surfaces, the inner surfaces, and the chewing surfaces of the teeth. To clean the inside surfaces of the front teeth, tilt the brush vertically and make several up and down strokes. Once you are comfortable with letting him brush on his own, usually around the age of 6, supervise that he is using the right amount of toothpaste and spitting it out. To help keep your child focused while brushing, set a timer. Play a favorite song or video for 2 minutes. Make a reward chart and add a sticker for every time he brushes for 2 minutes, 2 times a day. Once brushing becomes a daily habit, it'll be much easier to get your child to brush.
So how to reduce childhood caries. You do not want to allow your child to walk around with a drink throughout the day. You want to have a healthy, balanced diet for your child and limit starchy, sugary snacks and sugary drinks. You want to clean your baby's gums with a soft toothbrush or cloth and water starting at birth. Once their first tooth erupts, use a soft toothbrush twice a day. You want to use fluoridated toothpaste as directed by your child's caries risk, and which is determined by the dental or medical professional. And teach your child to start drinking from a cup as early as possible, preferably before they turn 1 year of age. By drinking from a cup, the liquid is less likely to pool around the front teeth.
So if you put your child to bed with a bottle, it basically is just sitting on their teeth all night long. So you want to make sure that they're either, not going to bed with a bottle, or if they do have to have some type of bottle, rinse their mouth out, or try to make them sip from a cup. That way it's not just sitting on their teeth. And it usually affects the front teeth first because it just pulls right there on those front teeth.
So now that y'all can't ask us questions, we're just going to go over some frequently asked questions about oral health and pregnancy.
So a commonly asked question regarding if you have a problem in your mouth or with your oral health is, what are some warning signs that you should look for? And some common warning signs that you may have a problem with your oral health would be some painful or sensitive areas of your teeth or your mouth, if you're having any kind of pain when you're chewing, if you have red, sore, or bleeding gums, especially if that is not normal for you. If you notice that your gum line is receding, so you have like a little bit of recession on some of your teeth, and also if you have bad breath.
All right. So is it safe to see the dentist while I'm pregnant? The major answer is yes. You want to see the dentist whenever you're having issues for your routine cleanings, just for anything to make sure that everything is going well. If you feel like your gums are more irritated, swollen and red and everything, then you really want to address that with your dentist so that he can help you if he needs to, because you don't want that to progress into anything more severe.
Yeah, if you're having any of these warning signs, definitely recommend going to your dentist just to get it checked out, just to make sure there's nothing else going on. And it is also very recommended to keep on schedule with your routine dental cleanings too.
The second trimester is the best if you have to have anything done, but you just still want to go and just make sure everything is good.
Mm-hmm.
Are dental x-rays safe during pregnancy? We say yes and no. We just try to make sure that if there is a problem that you're not able to see clinically, so whenever you open your mouth, we're not able to see that there's an underlying problem, then we do turn to x-rays. A lot of places do double up on the lead apron to protect you from any type of radiation. But for routine x-rays, like yearly x-rays, to keep them updated if you are due, we try to stay away from them if you absolutely do not need them, unless there is an underlying problem that we're not able to see.
Dental x-rays have a very small amount of radiation, but we do everything we can just to protect you and your baby. So we only take them as needed if there is a problem or something like that, or if the dentist does recommend it. We do not take x-rays just to take them or just because you might be due for them. It's all just kind of based on what you need personally, and we just try to make sure that to keep you and your baby as safe as possible.
Is dental anesthesia safe when you're expecting?
So mainly that's up to your dentist, depending on what you need. If you go to the dentist and they say you need deeper cleaning and you need anesthesia, they're probably not going to do that while you're pregnant unless it's something that really needs to be done. If you have to get a tooth taken out due to pain and an abscess that is present or inflammation and infection, then that would be discussed with your dentist. They probably won't use what's called epi, which is the vasoconstrictor, just because it's kind of contraindicated for pregnancy, but that's definitely up to you and your dentist and your circumstances and what's needed, but you do want to go to the dentist if you do have an issue like that.
Yeah, and there's some anesthetic that is safe for you whenever you're pregnant. We just limit the amount that we give you, and also it would just be for, something that needs to be done. Yeah, if something's causing you severe pain, then that would be something that they would be able to do. So you do have options. If you were to have to get a tooth pulled because it's giving you extreme pain, you wouldn't just have to live with that until you have your baby. There are options.
And then understanding that your baby feels what you feel, so if you're comfortable, then the baby will be comfortable, but if you're experiencing pain and stress, then your baby will also.
Another question, can I have teeth cleanings while I'm pregnant? We kind of talked a little bit about this before, but yes, absolutely you can, and it is definitely recommended just to maintain your oral hygiene, because as we discussed before, there is such a thing as pregnancy gingivitis and also pregnancy periodontitis, and you can have like an increase in inflammation and also see a little bit of bone loss because of all the hormones that are increasing in your mouth and stuff like that. So definitely keep up with your routine cleanings. That way, if there's anything going on, your hygienist and your dentist can catch it early and kind of help you take care of that and treat it and manage it.
So another question is, can a pregnant woman have a tooth pulled? We actually kind of touched on based on that also. Like we said, it's really between you and your dentist to see what needs to be done. If you're in excruciating pain, then they're probably going to find some way to help you relieve that pain, either that being it pulled or having a different procedure. And we also talked about the anesthetic to make sure that that's not going to cause you any pain while the tooth is being pulled. So it's really dependent upon what the dentist and you decide on doing. And most times, if your tooth's going to be pulled, we try to find some underlying cause why it needs to be pulled. So like we talked about the x-rays, if the dentist feels like he's not being able to see it clinically, then he'll take an x-ray to see if that tooth needs to be pulled. And if so, it can be pulled during pregnancy. We would just limit the amount of anesthetic if that was needed.
Yeah, and typically try to limit as much work being done until after you're pregnant, unless it is absolutely needed.
And then another frequently asked question is, how can I help prevent oral health problems while pregnant? So making sure, like we talked about earlier, just brushing twice a day. And we need to make sure we brush for 2 minutes with fluoride toothpaste, and then flossing at least once daily, because getting between the teeth is just as important as brushing the teeth. Rinsing your mouth after meals and eating a balanced diet. You want to do the last one?
You really want to make sure that you're not eating and drinking sugary and very acidic foods when you're pregnant. Well, pretty much anytime, but mainly when you're pregnant. And make sure to drink as much water as possible. And also to quit smoking and don't drink alcohol, because those are very harmful to you and your baby.
With the eating a balanced diet, you're getting a lot of the nutrients that you need to also help you, and your baby, but it's also helping your oral health. You need certain proteins and certain vitamins to maintain your oral cavity in the healthiest state possible. So making sure you're getting all your fruits and vegetables and your proteins that are needed during your pregnancy, and a lot of the vitamins that you take, like prenatals and other vitamins like that, have those vitamins and proteins that are needed to keep your mouth healthy during pregnancy.
And it's also really important to remember that our mouth is the gateway to our body, so keeping our mouth healthy affects the whole entire body. So if we don't have a mouth that's healthy, it could affect the rest of our body not being healthy, which could affect the baby.
All right, thanks.